Yalimadad, and good evening. Thank you so much for joining this webinar. My name is Rosina Bimji, and I will be moderating this evening's session. I'm a registered restorative dental hygienist with 30 years of experience in the private practice. I'm also on the board of directors with the Ontario Dental Hygienists Association. I am so excited for tonight's webinar, as I'm sure you all are. Tonight, we will cover a very important topic of a healthy mouth and how it's related to a healthy body. We will also discuss in detail root causes of halitosis, also known as bad breath, a common condition that is rarely discussed due to embarrassment, which can lead to anxiety that may impede on social and personal relationships. We will also discuss various factors such as sinus issues, acid reflux, diet, diabetes, and certain medications which can affect your mouth and your breath. I am so honored to introduce Kerry Lepicek to share her knowledge with us. Kerry is a registered dental hygienist and an international speaker. She's a highly focused and engaging presenter with over a decade of experience using an interceptive and preventive approach to treating gum disease. She's a trustworthy expert on oral biofilm, halitosis, and oral systemic link research. Her focus is on educating her patients and the dental profession on health and wellness. She has published several articles in the dental journals. She has been featured in several dental hygiene webinars and many podcasts. With Kerry's practical advice, it will transform your oral health. Tonight's webinar, A Healthy Mouth is Important for a Healthy Body. Feel free to ask your questions in the chat box, and we will allow time at the end of the webinar to answer your questions. And I promise we'll try and get through as many as possible. Without further ado, please welcome your speaker for this evening's webinar, Ms. Kerry Lepicek. Kerry, welcome.
Well, thank you very much. That was a really, really kind opening and some really nice, kind words, because I am really excited to be here today. I am a registered dental hygienist, and I work in a practice here in Toronto. And I love what I do. And these are some of the most important people. And they're the reason I go to work every day, because I love to connect with my patients. I love to offer them support. I really, really, truly love all things, because every day when I go to work, I feel like I'm a tooth fairy, okay? And every day I want to dress up and I want to, you know, bring my best to my office, because then if I bring my best, I can help you out, because my goal for every one of my patients is to save their teeth for their lifetime. And sometimes having a healthy mouth means you need to see me more often, or maybe you need to have a crown or a bridge or an implant. But my goal every day is to really be that tooth fairy, saving your mouth. And maybe by getting your mouth healthy, I'm saving your heart, or maybe helping you with your diabetes. You know, there's a lot of things that we do every day, and that's one thing I'm really, really passionate about. So tonight, I'm excited to be here. If you have some questions, please feel free to put them in the Q&A, and we'll do our best to get answer as many as we can tonight. So I find what happens a lot of the time is when patients come in to see me, they'll say, you know, Kerry, I really want white teeth. And I'm like, looking at their mouth, I'm like, oh my gosh, I want you to have white teeth too, but I see all these other problems. And so sometimes for us as dental professionals, it's really hard to get the information across to you to understand why it is that we're presenting the treatment plans that we are, or why it is that we think that you need to do that. Because maybe you want straight teeth, maybe you want whiter teeth, but we see all the other aspects. Like we could see the potential for diabetes or a risk of cardiovascular disease. Maybe we see a higher risk of cavities or dry mouth or bad breath. And so my job is to figure out what's under the iceberg and educate you so you understand that. So my question for you is, I want you to think about it for a second, is do you know how you catch gum disease, like periodontal disease? Most people think, oh my gosh, I'm not sure. We know how we can catch a common cold. We somewhat really know what we can do with corona now, but how do you get gum disease?
Yeah.
You actually get it from a transfer of bacteria from a partner, a spouse, a child, a mother, a father, somebody in your household, someone you're intimate with. That's how you transfer this bacteria. It's transferred through saliva. And so the thing is, you really need to have a healthy mouth to have a healthy body and healthy families in around you. So my other question for you is it normal for your gums to bleed when your teeth are actually cleaned? And most people will say, well, yeah, I had my teeth cleaned. That meant I had a really good cleaning. I spent time with Kerry. I got to see her 4 times to get my mouth cleaned. But bleeding is actually a sign of infection, is a sign of a big warning sign that there's an issue. You should, if you get your mouth healthy and you've got a stable breath, you should be able to have your teeth cleaned with no bleeding and no real soreness, honestly. The other
That's
thing,
true, Carrie. I hear you. You know, it's always that, right? That I got some bleeding, so I got a good cleaning today, and that's so normal.
I know, and I think that that's really a misconception. And, you know, as a dental hygienist, I don't want to make your gums bleed. I really don't. I want to have a healthier mouth so it's a cleaner environment for me to work in as well. And the reason that that's so important is that if you have bleeding, that's like you have infection, okay? If you have infection in your mouth, it is linked with the oral systemic connection, and this is where it all comes into play. They're finding the bacteria from between your teeth in many different aspects and areas in your joints, in your hearts, you know, even in the brain. And, you know, it doesn't mean that if you get your mouth healthy, you're going to never have these problems, but you can reduce your risk. And if I can do anything, I'm a risk assessment analyst in your mouth, and I look at so many things, and I want to reduce your risk. So please sort of check in with your dental professionals if you're having your teeth clean and it's bleeding. Ask them, what can I do differently to help my mouth so I'm at less risk? So how many times a day should you brush your teeth? So this is a question we get all the time. And the magic answer is for sure twice. If you can fit in a third, that's a bonus. And the trick is you want to make sure that you're constantly cleaning it, not too aggressively, but thorough enough that you're removing all the bacteria, which is called plaque or biofilm. And we want to make sure that that's removed. So should you clean between your teeth? Yes, you have to, and you should do it at least every 24 hours. So I try to ask my patients to do it once a day, okay? Some of my patients, they're night shifts, and so in the morning is best for them, the middle of the day, whatever fits into your routine. You wanna make sure that you're cleaning right between your teeth. And should I use mouthwash? This is again another hot question we get all the time, and I truly think that you should, because cleaning your teeth with your toothbrush cleans the teeth themselves. Maybe using floss or little picks between the teeth cleans between. But what about your cheeks, your tongue, and your throat? The only way to clean that is really with rinsing with something. And we're going to talk a bit about mouthwashes a little bit later on in the presentation. So I want to give you some history on what exactly is gum disease, or we'll use the word periodontal disease if you come into the dental office. It's really when your gums bleed when they're touched, brushed, or cleaned. And also what happens is if you break your bone in your arm, your bones generally repair themselves. In the mouth, when there's injury, when there's inflammation, when there's bacteria, it almost gets erased, okay? And it doesn't actually grow back unless it's physically put back into that position. So as a dental hygienist, when I see a bigger space or I see that bone being erased from between your teeth, I'm really concerned. I want to figure out a way to help stop that because I know it's not going to generally regrow at this point. The other thing that you may notice if you've got advanced periodontal disease or gum disease is your teeth might actually start to get loose. Sometimes too, we'll get questions about my teeth seem longer. I have what we would call recession. The gums move down on the tooth. And that can create sensitivity that, again, removes bone from around the tooth, so it changes the foundation or the support. And often within periodontal disease, when it's really advanced, you can also get quite a bit of bad breath and bad smell and a bad taste coming from between your teeth and sometimes at the back of your throat. So often when you have gum disease or periodontal disease, dental hygienists or dentists may suggest that we even see you 3 to 4 times a year. And you know what, we also may be offering or suggesting some additional therapies that are required. So maybe we'll send you to see a specialist like a periodontist, and they may put some gum on top of your recessed areas. Your long tooth can be covered by skin, and it can cover it over for better support, reduction of sensitivity, and overall good health in the mouth. Sometimes if teeth are lost, whether they be they're lost from having a root canal that failed, or gum disease, or maybe the tooth, you bit down on something and the tooth broke, those are really great options. And sometimes we have to send you for gum surgeries or periodontal surgeries, and that way then we're trying to kind of get rid of the diseased areas and get the foundations healthy. You know, that's the whole idea. I look at bleeding gums almost like building a house on quicksand. It doesn't work as well. You need a healthy foundation to build your skyscrapers up, and that's my goal for all of my patients. So the funny thing about gum disease is it doesn't hurt. And this is the hardest part about my job. When I see you in my practice, I'm like, okay, I've got to explain to you something that's really important, but it's not causing you pain. And so that's why often, sometimes our suggestions, I feel like, are kind of rushed or swept under the rug because you don't feel it, you don't understand it completely. We talked about how gum disease is transferred between loved ones, between pets and owners, all those sorts of things. And so this is why it's really hard for us to manage it sometimes. The other thing is we know that the bacteria doesn't just stay on the teeth. It covers the tongue, which is why cleaning the tongue on a regular basis is important. And it gets caught in the throat. And then the bacteria lives in your saliva. So as you swallow, it goes down and kind of coats the rest of the other organs. And that's how they're figuring out some of this motor transmission is happening. It's linked with many, many systemic diseases. And I mentioned a few, and today we're going to talk about a few more at the end as well. It's chronic and it's persistent and it keeps going, and it can show up in many different signs. Some patients will come into my practice and I see their mouth and I'm like, oh, you don't have any bleeding. You don't have any spaces or pockets, that bone loss between the teeth, but you've got a bad taste or you've got an odor. And those are areas I need to really assess. So if you're having a concern and your concern is a bad taste coming from a localized spot, maybe we'll talk about maybe using some mouthwash in that section, or using a different product to clean that area. Maybe the bacteria is caught up in that section and that's what's creating your bad taste or your bad breath. And the other thing we want to always look for are signs of swelling and inflammation. So when we look at our gums, we want them to be like a salmon pink color. If you see they're red or inflamed, or you see little W's or M's on the top or W's on the bottom, and they're red, those are areas like that you should really kind of bring to the attention of your dentist or dental hygienist, so then they can help you figure out how to manage that inflammation.
That's a great tip, Kerry, that the M's and the W's, because that's easy to remember and to look for. And I think, thank you for sharing that.
Yeah, it has to be very simple. It has to be practical, but it's got to work. And so today's lecture is really about giving you some knowledge, some background to sort of start your journey or to look at things differently, because all the dental people I've ever met in my life are all very caring people. We really want to have you like us, and we want to have you get healthy. But sometimes you put us in a spot where you ask us to watch things. Kerry, do I really have to have that cavity fixed, or could we wait 6 months? So the next time you ask your dental professional to watch, just remember it can mean withhold action until you hurt, until client hurts. And that's not what we want. We don't want you to have pain. We want to do the dentistry as easy as we can for you. And remember, watching sometimes is not your best option, okay? So one thing I always ask my patients when I see them is I ask them, how do you want me to treat you? Because your vision of what you want for your mouth and for your health is different than maybe what I want. So I always ask my patients, because I can be a mechanic and do transmission jobs and huge jobs on my car every time I see you, or I can do oil changes. And so I want to kind of connect with you, because sometimes it's hard. You look at this treatment plan that's been presented to you and the dentist says, oh my gosh, I have 12 cavities and I need all this work done. But the truth of it is, if we get this all done, then we're going to just be doing oil changes, and we'll be able to maintain it if you follow some of our guidance and our suggestions. So dentistry has changed over the years, like many things, especially with COVID. You know, back in the day when my aunt graduated, you know, this is basically what they looked like. And now when you come into CS, we've got masks, we've got visors, we've got N95s or different kinds of masks on. We've got gowns. Our doors are all closed in. It's a very different environment, and we're really having to modify and change based on our knowledge. And so today, as we've gone through so much in the last few months with COVID and all the modifications we've all had to take, dentistry is there, and now more than ever is a time to make sure your mouth is healthy, because we're learning, again, so much more. So that brings me to my next point. And one of the conversations I have with my patients on a regular basis is I always say to them, listen, I have your mouth for 3 to 4 hours a year, and you have your teeth for 8,760 hours. And it's what I do in my 4 hours with you that will impact the time you have with your teeth. So our goals really are to motivate and inspire you so you can then look after the cleaning and the daily bacteria, biofilm, plaque removal. So then all the therapies we do in our office will really last for you. Rosie, do you have anything else you want to add about that? Because I know this is a huge, huge thing.
Yes, it's a huge thing. And now that we can actually put the number to the visits, I think listen to your healthcare providers, listen to your dental hygienists, because they have knowledge of your mouth. You see them often, the tools that they suggest, the treatment that they suggest for you, it's for your therapy. And I think listen to them because they have so much more to offer. The things that they suggest for you to use them to improve your oral health and your teeth for a long period of time. Like look at the hours that you spend on your own and the hours we spend with us in when you come and visit us, that 3 to 4 hours a year, that's like nothing, right? So listen to your dental hygienist when she suggests a product and go with that.
And I think too, sometimes we get very excited about figuring out how to get you healthy, okay? And some people's plan is just one item, and other people it might be like, okay, we could do X, Y, Z, and all these things. If you're feeling a bit overwhelmed by the options, just say, listen, I can start with one thing. I'm ready to do one thing. What should it be? And slowly work at it. You know, the Empire State Building wasn't built in one day, but we want to have the same goals, the same outlooks, and we want to figure out a way to help motivate you and have these little baby steps we can make as we go forth.
For sure.
Because the truth of it is that the state of your mouth, the state of your oral health is a direct influence on your overall health. And this is known as the oral systemic connection. But there's a huge gap. And this is to do with the collaboration between dental and medical professionals. And there is a big divide. And I don't know about you, Rosie, but sometimes I have patients come in and they'll say things like, oh, yeah, no changes on my health history that you need to worry about. But any change you have, or I even want to know, is your medical doctor suspecting maybe you're pre-diabetic? Or is your medical doctor suspecting there might be an autoimmune problem? I would like to know that information so I can then have a different risk factor analysis when I look at your mouth and I look at your x-rays and I look at your home care. We need to know more about this. And so it's a lot to put on you patients, I know, but if you can help us with this collaboration, or if you're at the dentist and they say you've got a problem in your mouth, let your doctor know. Say, you know what, I'm being treated for gum disease and we're working at it. I don't know if that would be of interest for you to know about. If you can help us with this gap, I think it would be really helpful. Don't you think so?
Oh, 100%. How many times have we had to connect with the other providers to ask for, certain medications that they're taking, are they contraindicated? And this is the time that we need to collaborate with various healthcare workers, our pharmacists, our orthopedic surgeons, for that matter. That how many times we've had to call for that. So.
Exactly. And the thing is, the truth of it is that periodontal disease is a medical condition that we have to treat as dental professionals, and we're really good at it. We just have to get you on board and figure out the right ways to get you healthy that way. And part of the reason is that the bacteria in your mouth is linked with all sorts of systemic diseases. So we've got halitosis, CVD is cardiovascular disease, diabetes, decay, different kinds of cancers and Alzheimer's, arthritis, pregnancy-related complications. And remember, as I said earlier, it doesn't mean because you have this bacteria in your mouth that you're going to get those. It's a potential risk factor. They're starting to find correlations and links and all sorts of stuff. So it's there on the horizon. So we're here to ask you to do what you can to get your mouth healthy so you can have a whole better body. Because bad breath or halitosis or malodor can be assigned in many different ways. And 90% of halitosis cases actually originate in the mouth. And that 35 to 45% of people in the world have some level of bad breath. However, everyone will suffer from bad breath at some point in their life and at some point within the day. So my questions for when people always ask me about bad breath, I'm always asking them, how long of a concern is it? Do you brush your teeth and it goes away? Or do you brush your teeth and you get 10 minutes or 15 minutes of relief and then it comes back? And so there's variations within the severity of bad breath. Each year, did you know that Americans will spend over $10 billion dollars on
Yes.
oral hygiene products? Like, people are looking for choices and for options. And you know what? That's in gums and mouthwashes and toothpaste. And I am concerned, as I know, Rosie, you will agree with me on this one.
Yes.
If you're chewing a lot of gum, we want to make sure it's sugar-free. We want to make sure that it's not causing damage to your jaw joint, because from overusing those muscles and you're not getting more wear on your teeth. You know, we want to be aware of all these things because we have different choices and options for you. And 9 out of 10 bad breath sufferers will spend in excess of 72 hours and $400 a year just battling their condition. And this brings me to the severity of it. Rosie and I have been in practice collectively for a very long time. I'm not going to give you the number of years because that's what age us, but we've been in practice long enough. And you would think in being an expert in the mouth that people would be very honest and open with us about bad breath, but they aren't. There's a lot of faux pas that go along with it. And the truth of it is, if it's something that's bothering you, please do express it to your dental professional. They will be able to help guide you. Maybe it's a brushing issue. Maybe you need a specific mouthwash. Maybe you need some additional choices, because the truth of it is, we need to know it's a problem so we can help manage it with you. Because what I'll see sometimes when I treat patients with halitosis in my practice is that patients that I've helped have tried everything over the counter with very little success. Sometimes they go to see an ENT specialist, or they would have just visited a different dentist and they can't find a problem visually. But what we do sometimes differently is we'll look at the bacteria in your mouth, kind of like a blood work. We'll figure out what bacteria are present. We're also going to talk about diet, because skipping meals is a big problem for halitosis, as well as looking at what your diet consists of. If you're missing fruits and vegetables, that's not going to be good, okay? We need fruits and vegetables to provide good nutrients, good nutrition to our body so we can then better fight infection. And stress. I think everybody right now has been under such a huge amount of stress that can dry out your mouth, that can change your bit of your immune system in how you respond to the bacteria. So these three components are really what we want to focus on. And also the other thing is that there's a social faux pas, and many people believe that if you have bad breath, you should just chew mints or brush your teeth or see the dentist more. And sometimes I actually have seen these patients every 3 months, and they come in, they have very little inflammation, so very little bleeding, maybe no pockets or anything active of concern, but it's a bacterial component, it's a stress component, and it's a dietary component. When we control all those three factors, we've got a better result. And the other thing is, some of our patients that maybe are listening right now also have tried mouthwashes and they only get relief, like I said earlier, for 15 or 20 minutes, and then it comes back. At that point, it's really important to speak out, to reach out to your dental professionals and say, what should I try? What can I do differently? Please help me. But if you don't ask us, we can't offer some suggestions and help. So some of the questions that I want to know when I'm helping patients, and some things I want you to think about trying to figure out the severity of your breath concern is, do you worry about your bad breath all the time? I see patients sometimes like, oh, in the morning, I forget to brush at night. I know when I get up in the morning, I brush twice. I brush in the morning, have my coffee, brush again, and I'm okay. At that point, we don't really worry as much. But when it's something that's constantly on your mind, that's an issue. I also want to know about the taste in your mouth. How bad is it? What level of concern is that bothering you? What does it taste like? Is your bad breath affecting your social life? I've met some people, and you know, it breaks my heart. They won't they won't reach out for interpersonal relationships. They won't apply for promotions because they're worried they're going to have to talk in front of people. And that's a hard thing to do. So again, if this is you, please reach out to your dental professionals and let them know, because maybe we have some options for you.
That's true, Kerry. People don't even like talking like in public. They always hide on the side and they talk from a distance, or they cover their mouth, or they're very conscious of it, and yet they're afraid to talk about it. So,
They are,
you
and it's
know,
because people, the perception is like, you know, they just will, if they just brushed or they just went to the dentist, it would be cleared up. But sometimes it's not that easy. There's a lot of risk factors. And so that goes back to maybe what we'll do is we'll suggest a different kind of mint or gum or mouthwash. And if you're using it every day and it's not working, we need to change it up and figure out what's going on. I find that bad breath definitely affects your confidence usually. And again, that can be even just reaching out and saying something to your dental professional. I also want to understand is health concerns. What else on your medical history may be leading to your bad breath? Maybe you have an undiagnosed concern that's showing up as bad breath. And so there's that combination, that connection, why we need you to help us in this situation. The other thing is I want to always ask, if you have a concern, does anybody else in your family have a concern with bad breath or gum disease? That's where the bone is removed, that periodontal disease. Because again, remember, it's transferred back and forth. So your child may have bad breath, but you may have active gum disease. And so it's a combination of different ways that this bacteria can present with concerns for you. And the other question I have is, how often are you actually having your teeth cleaned? You know, Rosie and I get questions all the time. How often do I need to come? My insurance won't cover it, or my insurance says this or that. Really, we try to base our care on what we see. We look at your health history, we look at your mouth, and then we make a treatment plan, or, you know, a care plan for you. But often people that have concern with bad breath really should be seeing us at least sort of every 3 to 4 months, just to ensure everything is clean, the bacteria is all removed the best we can. We can help you, motivate you with your diet, your nutrition, your sleep, your stress. We can talk about a lot of things, because that will make a big difference for you. So true or false, I want you to think about this for a second. Can severe bad breath cause a loss of smell and taste? Why or why not? And the truth of it is, it actually can. So your olfactory senses are pretty smart, okay? And that's what makes you smell and smell. And what happens is that the bad breath smells so bad that after a period of time, your olfactory senses basically shut off and you can't smell your bad breath anymore. So some people maybe you're living with, some people you're working with, some people you're friends with, they may not even know they have a concern. So I'm not saying to, you know, go out to everybody and go, oh my gosh, you've got bad breath, go see your dentist, but find a casual way maybe to talk about it or to figure it out, because sometimes people are unaware that it's even an issue, okay? But please don't go and put a box of gum on their work desk. That's not necessarily the right way to go. And unfortunately, there may be people on the call tonight that have had that happen. I've heard that many times. Try to find a different way to connect with them to bring this up, because again, some people are unaware that there's an issue. So causes of bad breath, we've talked a little bit about this already, that it can be related to the bacteria, which we'll call plaque, we'll call biofilm, we'll call bacteria. It can show up as gingivitis, which is inflammation, bleeding. It can show up as periodontal disease, which is the bone when it's been erased. It can show up as concerns with cavities. Maybe you've got decay and dry mouth. Other concerns and causes of bad breath is hunger. So I often, when I review medical histories and I review diets with patients, I find sometimes that they're actually skipping meals and they're not eating enough. So a lot of people right now are, you know, really trying to reduce the amount that they're eating. They're very aware of this. And so if you're, you know, only eating for 6 hours a day and you're, you know, into fasting the other sections, you probably are going to produce a little bit more breath odor. So be aware of that, be conscientious, find ways to manage that for yourself, as well as look at what your diet is consumed of. If your diet has a lot of garlic and onions and spices that have a very strong scent, chances are you may actually have some odors from that as well. Exercise. So people that exercise on an empty stomach will definitely have more bad breath right away until they feed themselves, and then it will resolve. So again, looking at your diet, your lifestyle. What about stress? Gosh, I think everybody's been under so much stress in the last 6 months. I'm proud that all of us have made it through because it's been a really tough go for many individuals out there. And so stress creates dry mouth. Dry mouth produces more bad breath, gum disease, and gingivitis and cavities. And then the cycle keeps going round and round. So we have to figure out a way to reduce some of our stress. Maybe for you, it's drawing. Maybe it's exercising. Maybe it's, going for a walk, going for a drive. You've got to figure out in your lifestyle what that stress reduction can be for yourself. And snoring and sleeping at night. So often at night we snore or we sleep with our mouth open, which creates more dryness and then also can change the bacteria growth or bacteria load in your mouth. So again, it's back and forth, and this can be why you have some bad breath. Alcohol and smoking are issues, obviously. Medications, again, when we ask your health history, we want to know more about it. We want to understand what medications you're on. We want to understand what that medication may do to your gums. Sometimes you're on medication, it can cause you to have a higher risk of cavities, dry mouth. Sometimes your gums will change shape and color and they'll look different. And so we want to be aware of all these concerns so we can educate you to either know what to look for or to understand why we need to change your intervals in seeing us. What about postnasal drip and sinus concerns? I see a lot of people that have bad breath in relation to when their postnasal drip is acting up, or they get a chronic sinusitis and they have to kind of get that managed. And then once that managed, the bad breath is there. Because remember, the sinus is connected to the back of the throat and it drips all the way down and gets caught in your tongue. And an interesting fun fact, your tongue actually kind of connects back here. So as your sinuses drop down, it gets caught on the back of the tongue, and all that infection, all the rest can come further forward, creating usually bad taste. And so if this is something you're concerned with, talk to your healthcare providers, maybe a neti pot, maybe something else in conjunction to the therapies you're doing for your postnasal and your sinus infections may be helpful with your halitosis. Tonsillits, these are little tonsil pimples, and we're going to talk about that a little bit later. And medical conditions. So we find that often the medical conditions are not the issue. It's usually tonsillits, postnasal drip, and the list above this that are the main causers of halitosis in the mouth. When Rosie and I are looking at your health history, what we're looking for, what red flags that could lead to sometimes different smells or different types of odors in the mouth, acid reflux. And acid reflux is devastating to your mouth, as well as it can produce obviously an acidic breath. Postnasal drip and sinusitis can just taste bad, and it can lead to definitely an odor. Hernias are a huge thing. They smell really, really strong and really sort of foul in the odors. Diabetic can smell very sweet. Dietary concerns. So we can pretty much tell when people have missed meals because it's usually a very strong odor. They go to eat and it goes away. Kidney disease, sleep and airway, different kinds of cancers have different sorts of odors that are associated with it, medications, and again, those wonderful tonsil stones or tonsillits. So these are all.
So Kerry, sorry, what I wanted to say is sometimes when we're in the chair with our clients and we kind of go through this list and they say, why are you asking me these questions? But now you guys know that it's all related to the wellness of the mouth and mouth bacteria and other side effects that come with acid reflux. And for example, it's very common, and they say, well, why is that related to my teeth? But now you know.
I look at these as building blocks as well. So if you have acid reflux and you've got loss of bone and you've had a history of cavities and you're really stressed out, and it kind of builds it all up and creates quite a catastrophic event. And so I have this wonderful friend, and she is a size 00, and I love her to death. And she can eat French fries and potato chips every day and doesn't put on a pound. I feel like I have that once a week and I've got to watch my weight. And everybody responds differently. We have a different host immune response. We have a different level of our body will just respond differently given our background. So we have to know all these different pieces so we can do your risk assessment for you. And tonsillitis is something I know, I see quite a few patients that have these. Rosie, have you seen any patients or do you see this regularly?
Not on regular basis, but I see a few a year. Recently, we've had a case where my patient came in and said, "Rosie, my wife tells me that I have very bad breath, and I feel something. I see a white spot behind the very back of my throat. Please do something for me." And these are easily treatable. This is all bacteria that collects at the very back of the throat, and they do exist. So do mention it to your dental profession that you're experiencing the symptoms, and we can help you.
Yes, and these are really, you'll hear them called tonsil stones, tonsillis, and if you look, you'll see like almost look like little curd-like pimples that at the back of your throat. Some people can have them can extrude them themselves. Some people, they'll come out when you're talking. Often you'll get a sore throat that comes with it as well. So if you've got a sore throat and you know you're privy to these, you've had them in the past, take a look. Your tonsils may look really cryptic or almost like a strawberry in the summer where they're really nice and ripe, or raspberry is a better example. So raspberry's got all those little ins and outs. Sometimes your tonsils look like that, and what we have to do is to reduce that load. We've got to get rid of those little pimples and manage it. And so again, let your dental professionals know if this is a concern, and we should be able to help direct you with that. So some options that many people have tried to help treat your halitosis, you can use different mouthwashes, gums, mints. We want to make sure you're brushing, as we talked about, 3 times a day, flossing or using interdental cleaners, seeing the dental hygienist, and sometimes even water picks are great, or water flossers, because they kind of are like a power hose or a power washer for your teeth and gums. You can really help to get rid of some of that bacteria in there. Really great resource for you as well. So what causes bad breath and bad taste? It can be the imbalance of bacteria in your mouth. It can be medication, stress, dehydration, poor meal patterns, as well as people will describe it differently. Some people will say it's sour, it's bitter, it's dry, it's metallic. Again, you can figure out how to describe it, but giving us that information is really, really valuable. So children, they get their bad breath from their loved ones, from their parents, from their grandparents, from everywhere else. So, if you do have a child that suffers from bad breath, make sure that you're encouraging them to brush their teeth and their gum line. Look at their diet. Maybe they're missing parts. I have 2 children, as you saw in the pictures before. They're lovely, but sometimes their diet's not really well balanced because they just are not into eating as many fruits and vegetables as mommy dear would love. And so, for some children, it's brushing and looking at what they're truly eating, not what we're putting on their plate, but what are they actually consuming. Again, we need that fruit and vegetables to help fight off infection. And sometimes those are the easiest ways to start with children or anyone in general. So the longer your plaque stays, the more it grows. So I think of the bacteria in your mouth kind of like a downtown city core, okay? And it's busy and it's usually bustling. And the truth of it is, the more bacteria that's there, the busier and more active it is, the more of a concern. And what I want your bacteria to live like this highway in the middle of the country where there's not much traffic and there's not much happening. If we can balance your bacteria out so it doesn't cause bleeding, it doesn't cause bad breath, it doesn't cause cavities, then we really truly can help to keep your body healthy. And that's what our goal is. And so sometimes we'll do bacterial testing. It's kind of like having blood work for your mouth. There's swabbing or a saliva spit. And what it will do is it'll give us a list of what bacteria are present in your mouth. And from there, it can help us guide your treatment to know what to do for you. So we have talked about diet, and there are tons of different diets out there. I am not the expert in diets, but what I will tell you is I know who my dietitians are. I know to refer them back to your medical doctors to get more information if I suspect there's a concern. But we do have to look at what we're eating, and we need to eat it in the wholesome products. So not having orange juice as our vitamin C, but maybe having an actual orange. Having it in the whole form will really make a big, big difference. Being active, if I'm active, I'm healthier. And people have a misconception that activity has to be, a 30-minute run on a treadmill. No, activity could be walking around the block. It's all relative to what you do now. So if you're not doing anything for activity, your activity could be walking around the house 6 times or going up and down the stairs 6 times, walking up the street. But, I just want you to say is to do with stress, everybody has to have an outlet. And often some little bit of activity is good for the heart, it's It's good for the brain. It gets everything pumping, and ultimately it will reduce your stress. So find something that speaks to you. And this is really, really a valuable asset to what we do. So I don't know about you, but when you go to the dental hygienist or dentist, do we ever ask you, have you been flossing? And I get this look from patients, and it's like, I hate when my dentist asks that. When was the last time I was flossing? Dude, don't you remember? You were there. And people don't always like to floss. And I think cleaning between your teeth is so, so, so important. So Rosie and I know, come up with different alternatives sometimes for you. And so we want to make sure that you're cleaning between your teeth. So maybe we recommend a string floss, okay? So you can go up and down and clean the outside of your tooth. Or maybe you've gone and we've talked about a little brush to use between the teeth. Sometimes they have metal, sometimes they're plastic. There's different choices and reasons for that. And so you see what works for you, and this is what we want you to do. We want you to use something right between your teeth on a regular basis, because there's choices between using electric brushes and manual brushes, and cleaning with the electric brushes, like using a vacuum on your carpet, it works better than a broom. So figuring out what works right for you, and again, ask your dental professional. We sometimes get discounted rates on toothbrushes, so you can talk to them and see what it is, but it is overwhelming to go to the grocery store and walk down the aisle to figure out what toothbrush might work better for me. So sometimes, again, we will make these recommendations for you. We also know that there's different types of mouthwash, and this is a hot question I always get. What mouthwash should I use? What is the best choice? And sometimes in order for me to make a recommendation, I need to understand what you've already tried so I can recommend something different. As well, please remember that, at least in Ontario, when we sell dental products, whether it be a mouthwash, a toothbrush, anything, we don't make profit off selling mouthwashes or anything that way. We're doing it because we know it's best for you. So if there was a specialized program that your office has in there, and they're saying, you know what, I really think, Mrs. Jones, you should utilize this mouthwash for this reason, I would really kind of think about it. So again, if you're using mouthwashes, definitely look at what it's fighting. Some are better for cavities, and some are better for gum disease and bad breath. So there's different kinds of groups of bacteria and different kinds of mouthwashes. Again, things that your dental professional can help you with. Toothpaste, it's the same thing. There's so many different toothpastes out there. So again, ask your dental hygienist. Say, hey, what toothpaste would be better for me? Should I use one for cavities? Should I use one for gum disease? What do you recommend? And there's tons of choices out there and some really, really great products. So again, speak to us, because we will help guide you in these options, and we are more than willing to give you this information.
Trust me, Kerry. When I'm going shopping, I'm always in that dental aisle, checking it out, seeing what's new, what's available, because I know there's bound to be a question for me on Monday morning. Rosie, I saw this. What do you think of it? So
I know,
we try our best.
It's so overwhelming when you walk down those aisles. It's like, what do I choose? This is on sale and that's on sale. Does that mean it's good? Does that mean it's bad? How do I make my decision? So some of the key points we want to make sure you take away is that you should clean between your teeth. You can figure out what works best for you. You want to make sure you not only clean your teeth, though, you've got to clean your gum line. And sometimes what you're going to hear when you go to the dentist is you're brushing too hard, your gums are receding. And so look at your toothbrush. It shouldn't be lying down, it should be standing up nice and straight. We want to make sure that you're cleaning your tongue. Your tongue is a big asset of your mouth, and it's a great carpet for stuff to get caught in. So make sure you're cleaning it every day, using mouthwashes. And did you know you only need like a pea-sized amount of toothpaste? Everybody puts so much toothpaste on their toothbrush, and then it's not good. So a pea-sized amount of toothpaste is all that we need, even though most of us are going to be adults watching this. So a big function here as well is inflammation, and inflammation has been linked with so many systemic diseases. And tonight we don't have a lot of time to go through a lot of them that way, but diabetes is a big thing that we see, and we see so many people that have diabetes, and now I'm seeing so many more that have pre-diabetes. And so we're starting to screen people earlier, we're catching it, and we want to make sure that you never become diabetic. And so some of the signs we want to know, and why we go through our health history and why we're asking all these things, is we want to know what your bleeding's like. We want to know if you've had a sign of cavities, because if you have diabetes, you're at a higher risk of having cavities, and you're at a higher risk of having a dry mouth. And there's all these other things that kind of keep going. And in my office, in my experience, I actually have had 3 patients now that I said, if you're doing what you say you're doing at home and you're coming in as often, I think you've got diabetes. And eventually they did get to their family physicians and they were right, they had diabetes. So, you know, again, we're not just teeth cleaners, we do a lot more. And this is one of the big things that drives me in the practice than with working with people. So I really want to make sure that when people are diagnosed with diabetes, that not only do the physicians control their blood sugar, but they should also be prescribing the medication. They also want to look at their lifestyle, their exercise guidelines, and also who else can they refer to. I feel like when people are diagnosed with diabetes, I really hope soon that the medical side will say, you've got diabetes, make sure you get a checkup with your dentist, let them know. Because we can really help control your glycemic control. We can really help to get your diabetes in better control from getting your gums healthy. And so what we will do is, we've talked about tonight, diet assessment. Maybe we're going to suggest you see a nutritionist, bringing in how often and frequently we need to see you. And again, that exercise, that movement is key. Another asset, as many people suffer from, is cardiovascular disease, okay? And there were many recommendations years ago that said, if you have heart disease, you should see your dentist. And if you have cardiovascular disease, if you have active periodontal disease, you should see your physician. And so as much as I'm asking you to bring that information, us dental people have to keep, you know, reaching out to those to the cardiologists, to the medical side, and saying, hey, let's share this patient. Let's figure out a plan to get them healthy. Because these 2 amazing doctors wrote a book, and it's called Beat the Heart Attack Gene. And interesting enough, they run their clinic in the United States based on patients that have had a heart attack or a stroke. And what they figured out is that unless they brought the dental side into it, they really couldn't reduce the inflammation markers in the blood, and they weren't getting their people stable. Once they brought that collaboration together, they were able to do that. But this book has great tidbits, great tricks, great everything. So I encourage you to look at it. These guys are really pioneers in bringing this information together. So infections and pneumonia, this is something else I'm really, really passionate about, because did you know that if someone is hospitalized and you go in and brush their teeth once a week, okay? Once a week, it can reduce the chances of hospital pneumonia by 10%. So I think of that number and I'm like, okay, wait a minute. How do we figure this out? What do we do? And so anyone that is bedridden, anybody that, you know, doesn't have the opportunity to brush or look after them, I encourage you to try to brush for them, to recommend a mouthwash when you go to see some of our people we're caring for. All of these things will help reduce the risk, because it is so, so vital. So in dentistry, these are all the people I want to have in my connection and in my circle, and I can't do what I do and without my people. And I really want you to let us know if you're seeing some of these specialists or other people, let us know what they're saying so we can then ultimately help you out all together. So masks are a huge thing. So with masks now, we have mask mouth. And mask mouth has been known as a dry mouth that will happen, right? I think most of us are kind of smiling, go, yeah, I get that. And you know what, it puts us at a higher risk of cavities. The other thing is with masks, we want to make sure you wash them and you change them, okay? One mask does not mean one mask for a lifetime. If it gets moist, if it feels soiled, you should take it off and wash it, okay? It's really, really important to wear it. And the other thing is, you want to make sure that not only that your mouth is covered, but your nose is covered as well. We hear a lot that, you know, if you wear glasses, it's fogging up. Try a different brand, try a different style, but masks are something we're going to find in the very near future that is linked with some of these risk factors like cavities and dry mouth as we go forth. So there are, just to finish things up here, some common questions I get is, why do I keep having dental work redone? And sometimes it's because it wasn't done well initially, but often what we find is that the dental office, we couldn't explain or motivate you enough to change your cleaning habits. Remember that time we talked about at the beginning? We really want to manage that. So the other thing is, maybe you're grinding your teeth, maybe you've got too much sugar, and maybe we don't see you enough. So with that, I want to say, you know, tonight wasn't about scaring you, it was about caring for you. And so the difference is really one letter. And so I want to say a big thank you very much for having me tonight and for, you know, opening up your homes to listen to Rosie and I tonight. And Rosie, I saw there were quite a few questions that came in. So let's see what
Yes, we do. So Kerry, can you put that slide back up again about the book?
the book, of
Someone has
course.
asked. Yeah, if you can just bring that up while I
Yeah,
look
the
at
heart
other.
attack, Beat the Heart Attack Gene by
So
Dr.
someone
Brad.
was asking.
Yeah, and Amy Doneen. There we go.
So there are some questions here. So how often should I replace my toothbrush head?
That's a really good question. So I would say basically every 3 months. Often the toothbrush heads, some of them have indicator bristles, so you'll see that blue color sort of dissipating. If you've had a cold, I would change it right after you feel better. If you've been sick at all, and if the bristles are starting to lie down and bow down at you, that's a good time to change it.
The other question from the audience today, it says, can you explain what halitosis is in more detail?
Yes, so halitosis is a technical term for bad breath. So bad breath can be related to the bacteria in the mouth, and what happens is that bacteria actually breaks down proteins and food particles basically and produce a volatile sulfur gas, VSCs. That is what we smell as halitosis. And so when this all happens, it changes the environment, and bad breath with the volatile sulfur compounds makes it easier for the bacteria to break down the proteins, and then again can intensify the bad breath.
Another question, what extra care can a diabetic take in managing oral health care?
So the diabetics, you want to make sure that you're following your body's response and you're watching your diet. The second thing is probably seeing the dental professionals at least every 3 to 4 months preventatively, making sure that if you do have areas that have bleeding or plaque, that you're figuring out ways to combat that. Because I would rather see you come in with 1 or 2 hot spots or areas with bleeding than have a whole mouth. So really work on your home care, maybe look at other tools, power brushes or a water pick or something else to add with a mouthwash would be the best way to handle that.
Another question, Kerry. Good questions this
Yeah.
evening, rather. Please comment on the use of electronic toothbrushes. Are there any advantages of using an electronic toothbrush?
So that is a twofold question. I think the science and the research behind electronic toothbrushes is phenomenal. I really love them. But there are some people that don't like them at all. They find them either too much of a vibration or another issue. But I truly think the difference of an electric brush to a manual brush, an electric brush is like using a vacuum on a carpet versus a broom. The electronic brush is going to generally remove the bacteria more. You're going to get healthy much faster and much easier. So I really love it. And I love the smaller round heads because then you're almost cleaning 1 tooth at a time versus cleaning 3 or 4 at once.
Yeah, I agree with you, Kerry, and that's the right, that's always been my recommendations, that the smaller heads, oscillation and all that. Along the same lines, Kerry, one question about brushing their tongue or using the tongue scrapers. How often should I be using a tongue scraper, or do you recommend one?
So there are tons of different kinds of tongue scrapers out there. Some of them, people will say they prefer a metal one over a plastic one. I would say try and see what works best for you. Again, I think using a tongue scraper is a much better option than a toothbrush, because a toothbrush just moves the bacteria like this back and forth, and a tongue scraper physically takes it off. Now, if you're new to tongue scraping, please remember your tongue has little hairs or little fibers on it. We don't want you to clean them all off, okay? So it's like a light or maybe a moderate at the most pressure as you pull from the back of the tongue forward. And for most people, it's gonna be 3 swipes, 1 in the middle and 1 on either side. The skin on your tongue sometimes, or the deposits, the stuff that you're gonna see come off, the plaque on your tongue, Some people get it rebuilding every day. Some people, it takes a week to rebuild. It's kind of like your own body's immune system and all the skin cells that are shed. So some people should do it every day. So when you see your stuff that comes off your tongue, you'll know, can I do it every other day, or do I need to do it once a day?
Thank you, Kerry. I think we have one more question we can take.
Okay.
Do rheumatoid disease affect dental cavities, gum disease, oral infections, and/or tongue health? If so, what extra care should one consider?
So anytime someone has an autoimmune disease or disorder, I think that the key things you want to look at is stress, you want to look at diet, and you want to look at home care. So if someone has any sort of rheumatoid arthritis or rheumatoid diseases, I want to make sure that your mouth is as infection, inflammation free as possible, as well as you don't have a lot of bacteria there. So, you know, going over your brushing, making sure that you've got the most adequate home care. So maybe, you know, you're not just going to be the person that's a brush and a floss or a brush and a pick. Maybe you need to use a water pick in addition and a mouthwash. The trick is we want to reduce the bacteria load in your mouth and keep you as healthy as possible to reduce some of the side effects. As well as with medication, some of the medications maybe you're on will produce a drier mouth, which will put you at an increased risk of cavities. And sometimes it can also affect your tissues, your gums.
Sorry, Kerry, I'm going to do a quick one here, just a short one. What do you recommend for sensitive teeth?
Okay, sensitive teeth. There are many different types of sensitive toothpaste out there. And so again, you can try the over-the-counter one. Sometimes we in the dental office as well, will put different kinds of fluorides on your teeth. There's now varnishes, or sometimes people will require a filling. But I would try the sensitive toothpaste out there first. You'll see them branded as for sensitivity. And sometimes those, let me just add one more thing, sorry, Rosie. Sometimes
Go ahead.
take, people want an immediate response sometimes for sensitivity, but sometimes it takes almost sort of 2 to 6 weeks to see a big difference. So if you try it for at least 4 weeks and see if you notice a change.
Yeah, that's for sure. So sorry, we will almost coming to an end of the session. Kerry, thank you so very much for your valuable time and the information that you have shared with us tonight. It has been very informative, and judging from our questions this evening, we have not been able to answer everything, but we will try and see if we can answer them offline for you. So on behalf of Ontario Dental Hygienists Alliance, we would like to thank our audience for participating in tonight's webinar. Kerry, thank you once again. We hope that this webinar has empowered you all to prioritize your dental health. It's our hope to bring more informative webinars in the near future. I would like to thank Aga Khan Health Board, our IT and communication teams who do so much work behind the scene for tonight's webinar. We are so humbled to be given this opportunity to address the Jamaat on this important topic. The recording of this webinar will be available on demand. So if you know anyone who has missed this session, please share the link with them so they view this important webinar. A healthy mouth is important for a healthy body. Also, a friendly reminder, you will receive a short survey about the webinar tonight. Take a few minutes to fill it out and give us your feedback, because the feedback we receive from you is very valuable in future programming. We wish you all a very good evening, and Kerry, once again, for your time, and the audience for participating this evening. So have a great evening, and Yali Mada to everyone.
Bye, everyone. Thank you very much.
Thank you, Kerry.